The heart is a muscular structure with 4 chambers, including 2 atria, which are the filling chambers, and 2 ventricles, which are the pumping chambers. The venous blood is drained from the body to the right chambers of the heart, then oxygenated in the lungs and ejected to the entire body by the left chambers of the heart. To accomplish this task, the human heart has 4 valves, flaps made of tissue, that control the direction of blood flow in the circulation. The valves open in one direction, like one-way gates. This allows blood to flow forward. Each time your heart beats, it pumps blood through these valves by squeezing or compressing the chambers. In some patients, due to disease, age, or birth defect, calcium deposits build up on the aortic valve. This causes the valve to not close properly or open fully, placing undue stress on the heart.
The valve is closed down to the degree that you're only getting 0.6 square centimeters of space for blood to get out to the body, and you can imagine it severely limits what the patients can do, causes chest pain, patients will pass out.
I got lightheaded, fell over several times. I also had some chest pains. Well, it didn't feel very comfortable, and it seemed to be getting worse all the time.
It's really the onset of symptoms that heralds the need for something to be done about the aortic valve.
You're always wondering what's next, whether you're going to keep going or fall over or what.
They really feel like they can't get their breath, and they have to present immediately to the hospital.
They gave me about 6 months to live if I had nothing done.
The condition is known as severe aortic stenosis and requires an aortic valve replacement. Until recently, the only procedure available to replace an aortic valve required open heart surgery. Today, using a minimally invasive procedure and cutting-edge biomedical design, the physicians at WellSpan are able to replace the aortic valve without opening the patient's chest.
The new procedure, which is called transcatheter aortic valve replacement, allows us to replace the valve without the need of median sternotomy or a major incision down the chest.
These patients are now going to be offered a treatment option, whereas before they would have been denied it.
Well, Dr. Nicholson and Dr. Shears and Dr. Mills went into great detail concerning the risks and benefits.
You're passing a large catheter through the body to get up to where the heart valve is, and then you're replacing a heart valve with a catheter.
Because the procedure is so involved and the potential complications are so great, it really takes an integrated team of everybody there with the common goal of let's get this patient through this procedure as safely as possible.
The team at WellSpan meets bi-monthly to review candidates for the procedure. This group, as a whole, decides on the appropriateness of the procedure for the patient.
The advantage to the patient, really, is the fact that we've got multiple doctors from several different disciplines working together.
We sit down with a multidisciplinary conference that includes Dr. Mills, Dr. Shears, and several of us from cardiology, and we review the cases, and we talk about the case, talk about the patient, review the films, review the echoes, and make a group decision. Is it a good candidate for a transcatheter aortic valve replacement?
That expertise all comes together at the same time for one patient.
And we're all there guarding each other's back to make sure that the patient gets the best outcome.
And it speaks to the teamwork that's involved in the procedure itself.
Once the candidate is qualified, the procedure can move forward. The entire team is present. The procedure is centered around the deployment of the Edwards-Sapien transcatheter heart valve. The transcatheter heart valve is a biological valve made from heart tissue and is deployed to the heart via a transcatheter. For the procedure, the patient is placed under general anesthesia. With a small incision in the leg, the cardiologist accesses the femoral artery. A catheter is then guided through the femoral artery to the damaged aortic valve. Fluoroscopy, a type of X-ray, is used to help the cardiologist guide the catheter to the deployment site. The new valve, compressed around a balloon and no wider than the width of a pencil, is then placed on the delivery system and guided to the damaged aortic valve. The balloon is then inflated, causing the new valve to expand and replace the damaged aortic valve. The balloon is then deflated, allowing the new Edwards Sapien transcatheter heart valve to take over the valve operation. Once your doctor is satisfied the new valve is functioning properly, the catheter will be removed and the incision in the leg is closed. The procedure takes 4 to 5 hours.
Yeah, in some ways, it does look like it's basically like a straightforward cath, and we've done a lot of work to make it look simple.
The beauty of it is the simplicity of it, and that's also why it's tolerated by patients that are often quite ill.
It involves multiple doctors all working together for the benefit of a single patient. And that's part of the elegance of it.
You really need everybody there on the team, ready to do what they do best.
And we've called on that on almost every case, that there's a time that somebody needs to do something that nobody else in the room can do, and unless you have each of those parts of the puzzle there, you're not going to have a successful outcome.
Recovery takes up to 8 days in the hospital. Blood thinning medication may be used for up to 6 months following the procedure. An aspirin regimen may be recommended for the rest of the patient's life. A special diet, physical rehabilitation, continued exercise, and follow-up visits are all part of the recovery process.
The studies are very clear. This is a procedure that improves survival by at least 20 to 25% over the next few years.
It's astounding, and so the patients, experience that relief of symptoms almost immediately.
And that is offered to a patient who otherwise was not able to have anything done.
But that's fairly quick recovery, and otherwise back to better than what they were before very quickly.
I feel better now. I can walk farther. I don't have the pains in the chest anymore. I was a lot happier than I was before the operation.